If you are over 60 and taking blood pressure medication every single day, you need to hear what I am about to say. Because there are 4 critical mistakes that millions of seniors make with their blood pressure medication. Mistakes that cause their medication to stop working. Mistakes that silently allow blood pressure to stay dangerously high even when they think it is controlled. And mistake number 1 is so common, so widespread, that I guarantee at least 70% of you watching this right now are making it. And your doctor has never once mentioned it. I'm Dr. Ashley Morgan, and in 18 years of studying cardiovascular health in older adults, I have seen this pattern repeat itself thousands of times. A senior comes in, they are taking their medication faithfully, their blood pressure should be controlled, but it is not. It is still high. Still dangerous, still quietly putting their heart, their brain, and their kidneys at serious risk. And every single time when I ask the right questions, I find one of these 4 mistakes. In this video, I am going to walk you through each one. I will rank them from concerning to absolutely critical. And when we get to mistake number 1, I think you are going to stop and think about what you did this morning, because this mistake has nothing to do with the medication itself. It has everything to do with what you are eating and drinking alongside it. Something that sits in millions of senior kitchens. Something most doctors never warn about. Stay with me, because by the end of this video, you will know exactly how to take your blood pressure medication correctly. You will understand what to avoid, you will have a clear action plan, and you may finally see those numbers come down to where they actually need to be. Before we go through these 4 mistakes, I need you to understand why blood pressure control matters so deeply after 60. Your heart has been beating for over 6 decades. It has pumped blood through tens of thousands of miles of blood vessels, and over those years your arteries have gradually stiffened. The walls have thickened. The inner lining, called the endothelium, has accumulated small amounts of inflammation and plaque. This is a normal part of aging. Every person over 60 experiences it to some degree. But when blood pressure is high, when your heart is pushing blood through those stiffened arteries at excessive force, the damage accelerates dramatically. High blood pressure tears the delicate endothelial lining of your arteries, creating inflammation, allowing plaques to form and grow. It enlarges and weakens your heart muscle. It damages the tiny blood vessels in your kidneys, leading to chronic kidney disease. It ruptures blood vessels in your brain, causing stroke. And it does all of this silently. No pain, no warning, no symptoms, just quiet, relentless damage until something catastrophic happens. This is why blood pressure medication exists. It reduces the force of blood against your arterial walls. It gives your heart and vessels relief. When taken correctly, it reduces your risk of heart attack and stroke significantly. When taken correctly, that is the critical phrase, because all of that protection disappears when you make these 4 mistakes. Let me tell you about Richard. Richard was 72 when his wife brought him to see me. He had had his first heart attack at 68. He had been on blood pressure medication ever since. His cardiologist had prescribed him 2 medications. He took them every single morning without fail, never missed a dose, not once in 4 years. And yet his blood pressure readings at home were consistently around 155/94, dangerously high for someone with existing heart disease. His cardiologist was frustrated. His wife was scared. Richard could not understand why his medications were not working. I sat with Richard for a long time. I asked him detailed questions, how he took his medications, what he ate and drank alongside them, what else he was taking. And within 15 minutes, I found 3 of the 4 mistakes I am about to describe, 3 of them in one patient. A patient who thought he was doing absolutely everything right. Let us start with mistake number 4. This is one most people have genuinely never heard of. I am talking about taking your blood pressure medication alongside grapefruit juice or eating grapefruit close to the time you take certain medications. If you are on a specific class of blood pressure drugs called calcium channel blockers, and this includes felidipine, nifedipine, and nisildipine, grapefruit is silently interfering with your medication in a way that makes it unpredictable and potentially dangerous. Here is why. Your liver and intestines contain an enzyme called CYP3A4. This enzyme is responsible for metabolizing, for breaking down, many medications before they fully enter your bloodstream. It acts as a control mechanism. Your doctor prescribes a dose that accounts for this breakdown. The dose is carefully calculated to deliver exactly the right amount of drug into your circulation, But grapefruit contains natural compounds called furanocomerins. These compounds inhibit CYP3A4. They block this enzyme for up to 24 hours. So when you eat grapefruit in the morning and take a medication like felidipine later that day, or even the next morning, that enzyme is still partially blocked. Less of the drug gets broken down before reaching your bloodstream. More of it enters your circulation than your doctor intended. Blood pressure can drop too low. You can feel severely dizzy, lightheaded, or faint. In serious cases, you can fall and sustain an injury. The erratic drug levels can also contribute to irregular heartbeats. Richard was drinking a large glass of grapefruit juice every single morning. He had been doing it for years. He genuinely believed it was the healthiest thing he could do. His cardiologist, his pharmacist, nobody had ever mentioned it. He was on felidipine. I explained the interaction. He was shocked. He stopped the grapefruit juice immediately. Within 2 weeks, his blood pressure readings became more stable and consistent. The unpredictable swings reduced noticeably. Here is what you need to do right now. Check whether you are taking felidipine, nifedipine, or nisildipine. If you are, eliminate grapefruit and grapefruit juice from your diet completely. Not just at the same time as your medication, completely, because furanocomerins inhibit the enzyme for up to 24 hours. 1 glass in the morning can affect your medication taken that evening or the next morning. Regular oranges, lemons, and limes are fine. It is specifically grapefruit and to a lesser extent Seville oranges and pomelos. If you are unsure whether your specific medication is affected, call your pharmacist. Tell them your exact medication name. They can tell you within seconds. Now let us move to mistake number 3. This one is extremely common and genuinely dangerous. I am talking about taking ibuprofen, naproxen, or other nonsteroidal anti-inflammatory drugs alongside your blood pressure medication. This combination is one of the most overlooked contributors to uncontrolled blood pressure in older adults. And yet most seniors take these pain relievers without a second thought. Here is the mechanism. NSAIDs work by blocking enzymes called COX-1 and COX-2. These enzymes produce prostaglandins, which are inflammatory molecules that drive pain. Blocking them reduces your pain and swelling. That is why they work so well. But prostaglandins also play a critical role in your kidneys. They help your kidneys manage sodium balance and regulate fluid levels in your body. When you block prostaglandins with NSAIDs, your kidneys retain more sodium. Sodium retains water. Blood volume increases. And when blood volume increases, blood pressure increases. Research published by the National Institutes of Health confirms that regular NSAID use can raise systolic blood pressure by 5 to 10 millimeters of mercury in people with hypertension. That might not sound dramatic, but it is enough to completely counteract many blood pressure medications. You are taking a drug to lower your pressure while simultaneously taking another drug that is raising it. They are working directly against each other. Richard was taking ibuprofen every single day for arthritis pain in his knees. He had been doing it for years. Nobody had ever told him this was a problem. He did not consider it a real medication, just something for knee pain. But that daily ibuprofen was actively fighting against his blood pressure treatment. What should you do? If you have chronic pain and you are on blood pressure medication, talk to your doctor about safer alternatives. Acetaminophen, which is sold as Tylenol, does not raise blood pressure and is generally a safer option for people with hypertension. Topical diclofenac gel applied directly to painful joints delivers medication locally with far less effect on blood pressure than oral NSAIDs. Physical therapy and specific exercises reduce joint pain without any medication at all. If you genuinely need an NSAID occasionally, use the lowest effective dose for the shortest time possible and monitor your blood pressure closely during that period. Also check your over-the-counter cold and flu medications. Many decongestants, particularly pseudoephedrine, which is the active ingredient in Sudafed and many multi-symptom cold products, raise blood pressure by directly constricting blood vessels throughout your body. If you have hypertension, read every label carefully. Avoid any product containing pseudoephedrine or phenylephrine unless your doctor has specifically told you it is safe for you. Now let us move to mistake number 2. This one feels logical in the moment, but it is one of the most dangerous things you can do. I am talking about skipping doses or stopping your medication because your blood pressure looks normal or because you feel fine. I hear versions of this constantly. My reading was 118/76 this morning, so I skipped my medication today. Or I ran out of my prescription and I feel completely fine, so I will refill it next week. Or my numbers have been good for 3 months, so I decided to try stopping and see what happens. I understand the thinking. But this reasoning is genuinely dangerous for 2 very important reasons. First, blood pressure medications work because you take them every day. Many have what is called a half-life, a period of time before the drug clears from your system, though this varies significantly depending on your specific medication. When levels drop, blood pressure rises. And with certain medications, particularly beta blockers and clonidine, stopping suddenly can cause a rebound rise in pressure that pushes your blood pressure even higher than it was before you started treatment. This rebound effect is a documented medical phenomenon. The sudden sharp rise in pressure significantly increases the risk of heart attack and stroke in the days immediately following abrupt discontinuation. Second, and this is the most important point I will make in this entire video, blood pressure has no symptoms. You absolutely cannot feel whether your blood pressure is 120 or 175. You feel completely fine at 175 just as much as you feel fine at 120. This is precisely why it is called the silent killer. The fact that you feel well today means absolutely nothing about what your blood pressure is doing to your arteries right now. While you feel perfectly fine, plaques are being stressed, arterial walls are being damaged, the risk of a sudden catastrophic event is elevated. The good blood pressure numbers you saw this week exist because the medication is working. Stop the medication and those numbers will rise. The solution is simple but non-negotiable. Take your medication every single day without exception. Set a daily alarm on your phone. Keep your medications on the kitchen counter next to your breakfast. Use a weekly pill organizer so you can see at a glance whether you have taken your dose. Connect it to a habit you already do every morning, and never skip because you feel fine. If you want to reduce or stop your medications because you have genuinely improved your lifestyle, because you have lost weight, changed your diet, started exercising, that is a conversation to have with your doctor. They can supervise a careful, monitored reduction. Never attempt this on your own. And now we arrive at mistake number 1. The most overlooked, the most widespread, and based on emerging research, potentially the most impactful mistake seniors make with blood pressure medication. I am talking about taking your blood pressure medication exclusively in the morning when your blood pressure may actually be most dangerous in the early morning hours before and after waking. Here is something most people do not know. Blood pressure is not constant throughout the day. It follows a natural 24-hour rhythm called a circadian pattern. During deep sleep, blood pressure in most healthy adults naturally dips. Then, in the hours before waking, blood pressure begins climbing. By the time you get out of bed and begin moving, it is rising significantly. This morning surge is real. Studies consistently show that the majority of heart attacks and strokes occur in the early morning hours between approximately 6 and noon. Part of the reason is this blood pressure surge. Now here is the problem with taking all your blood pressure medication in the morning. That medication reaches its highest concentration in your blood several hours after you take it, typically during the afternoon when your blood pressure is already naturally moderate. And by the following morning, as you approach the next dose, drug levels in your blood have been declining for hours. So the medication may be at lower levels precisely during the morning surge when blood pressure is rising and cardiovascular risk is elevated. A large Spanish study called the HYGIA chronotherapy trial, published in the European Heart Journal, followed over 19,000 hypertensive patients for several years and found that those who took their blood pressure medications at bedtime had significantly better cardiovascular outcomes compared to those taking medications in the morning. It is worth noting that subsequent research has produced mixed results, and the scientific discussion around optimal timing is still ongoing. But the underlying rationale for considering bedtime dosing is sound, and many cardiologists now discuss it with their patients as a worthwhile individualized consideration. What does this mean for you? It means this is absolutely worth raising with your doctor at your next appointment. You can say, I have been reading about circadian patterns in blood pressure and the research on bedtime dosing. Given my specific medications and my blood pressure pattern, do you think moving any of my medications to bedtime could benefit me? That is a specific, intelligent, well-informed question. and it may lead to a simple change in timing that improves your cardiovascular protection meaningfully. However, this does not apply to every medication. Diuretics, also called water pills, should generally be taken in the morning because moving them to bedtime means waking up repeatedly through the night to urinate, which disrupts sleep and creates its own health risks. Some medications can also cause a sudden drop in blood pressure when you stand up, which is more dangerous at night when you may rise in the dark and feel dizzy. This is why this conversation must happen with your doctor. It is highly individualized. The right answer depends on your specific medications, your blood pressure pattern, and your overall health. Richard made all of these changes. He eliminated the grapefruit juice. He replaced his daily ibuprofen with acetaminophen for knee pain and began working with a physical therapist. He set a daily alarm and never missed a dose again. And after a conversation with his cardiologist, he moved one of his 2 medications to bedtime dosing as a supervised trial. Within 6 weeks, his blood pressure readings had improved significantly. The stubborn numbers that had resisted 4 years of medication finally started moving in the right direction. 3 changes, no new medications, just taking his existing medications correctly. Now, many of my patients ask me whether there is anything beyond medication to support their blood pressure and arterial health while they are implementing these changes. And my honest answer is this: medication manages the numbers. But it does not address the underlying endothelial dysfunction that contributes to high blood pressure in the first place. Your endothelial cells, the cells lining your arteries, produce a molecule called nitric oxide. Nitric oxide is what keeps your blood vessels flexible, relaxed, and dilated. In people over 60, nitric oxide production naturally declines. Arteries stiffen, blood pressure rises. One supplement that many of my patients have found helpful alongside their medication is Vino Plus 8. It contains specific nutrients that support your body's own nitric oxide production. Think of it as supporting the foundation of your vascular health while your medication manages the numbers on top. There is a link in the description if you want to learn more, and it comes with a money-back guarantee. But always remember, your medication comes first. This supports. It does not replace. Let me now give you your complete action plan. 4 things to do starting today. Number 1, check your medication name. If you are on felidipine, nifedipine, or nisildipine, eliminate grapefruit and grapefruit juice from your diet completely, starting today. Number 2, check every pain reliever, cold medication, and anti-inflammatory supplement in your home. If anything contains ibuprofen, naproxen, pseudoephedrine, or phenylephrine, talk to your doctor about safer alternatives. This conversation could make an immediate measurable difference in your blood pressure control. Number 3, set a daily alarm right now. Before this video is finished, set an alarm for the same time every single morning. Your blood pressure medication cannot protect you if you do not take it. Number 4, at your next doctor appointment, raise the topic of medication timing. Bring up the research on circadian blood pressure patterns. Ask specifically whether any of your medications could be appropriately moved to bedtime. Make this a priority conversation. Before you go, I need 3 things from you. First, subscribe to this channel and turn on notifications. I publish new content every single day specifically to give you the kind of detailed, researched, mechanism-based information that helps you understand your own health and take control of it. Subscribe so you never miss it. Second, leave a comment below. Tell me which of these 4 mistakes you were making before today. Tell me if you are going to speak to your doctor about timing. Tell me if you already knew about the grapefruit interaction. Every comment you leave helps YouTube understand that this content is valuable. It helps this video reach more people who need this information. Third, share this video. Send it to someone you know who is over 60 and on blood pressure medication. Text it to them right now. Because somewhere at this moment, someone is taking their medication with a glass of grapefruit juice. Someone else is fighting their blood pressure medication with daily ibuprofen. Someone else has skipped their dose 3 times this week because they feel fine. This video could change that for them. But they will never see it unless you share it. One final thought: blood pressure medication is one of the most powerful tools in modern medicine. It has saved and extended millions of lives, but it is only as effective as the way you use it. Avoid the foods and drugs that interfere with it. Take it without exception every single day. Consider the timing in conversation with your doctor, and support your underlying vascular health with the strategies that address the root causes. When you do all of these things together, you give yourself the strongest possible protection for your heart, your brain, and your kidneys. That is what this is about. That is why I made this video. I am Dr. Ashley Morgan, and I will see you tomorrow.